they didn't do any of this nonsense.
Survivorship bias, hello. A lot of you guys have been telling me I need to check out Rohin Francis from Medlife Crisis' video on the problem with Silicon Valley medicine. So I'm gonna watch it, react to it, and for those of you who are new here, my name is Kevin Jabal, physician entrepreneur based in Las Vegas, formerly in plastic surgery. So Rohin Francis, awesome channel, always super entertaining, one of my buddies. Let's see what he has to say.
If I say to you medical grifter, you probably think of people selling quack remedies. You might not immediately think of the enormous industry loosely centered around longevity, focused on maximizing lifespan, optimizing performance. And this is futuristic, sexy, cool sounding stuff. These guys feel like they're invoking science because they reference some study, apparently utterly ignorant to the fact that it's complete garbage.
He has a good point here, which is that a lot of this longevity focused medicine and the conferences and the things that people are pushing, a lot of it is garbage, to be honest. But if maybe 70% of it is garbage, I think 30% of it is actually really good. So as you guys know, my favorite word is nuance. I don't like black and white thinking. I don't like summarizing or ascribing an entire field or interest of medicine to being complete garbage. There's a lot of noise there, but there is some signal as well.
So many of them are medical doctors who either demonstrate what I've said many times, that you really don't have to be that smart to be a doctor.
True that, you don't have to be that smart to be a doctor. You just have to work hard.
But the other day, tech entrepreneur Peter Diamandis posted, "Most of us have no idea what is really going on in our bodies. Every year, I do a full body MRI, an AI-driven CT, genome, microbiome, and much more."
Okay, right off the bat, this is a big no-no. I'm sure that Rohin is gonna say this too. But there's this thing called overdiagnosis and overtreatment. If you're doing a full body MRI and a full body CT, first of all, there's a lot of radiation with a full body CT. You're gonna find a lot of things that you're gonna act on that ultimately don't improve your health outcomes, but they do pose significant risks with the various interventions that you pursue.
This man claims to be interested in longevity, but only does these tests once a year? I mean, what an amateur. Every morning, I perform a full body MRI, colonoscopy, bladder flow cytometry, testicular volume analysis, lung function, liver percussion, and complete genomic sequencing in case I've been replaced by a clone in my sleep who differs from me by just one base pair on chromosome 15.
This is why I love Rohin.
The urge to measure everything is not limited to tech bros. Over a decade ago, The Atlantic ran a piece about a computer scientist named Larry Smarr. He was measuring everything: weight of food in, constituents, how many steps he took. He collected all of his feces and urine, had it analyzed. He said that stool had a capacity of 100 terabytes of data per gram. I guess that's what you'd call a semi-solid state drive. Counting our steps. Forward 10 years and we're all counting our steps, oxygen saturations, our heart rates, and diligently entering our food intake into apps.
Okay, hold up. So we're comparing measuring everything you eat and excrete and everything very meticulously to then wearing a Fitbit. Huge difference, which is that one of them is completely automated, completely hands-off, just happens in the background, right? I wear my Apple Watch every day. I don't have to enter anything. It just automatically tracks things. I don't have to look at the data or intervene. But then in the future, when I want to see, oh, what has my estimated VO2 max been, and I can see a trend, that is useful.
I'm not saying that gathering data is bad. It's what we do with that data that is the problem, how to interpret it. But that should be as actual research, not individuals making decisions based on half-cooked data and huge assumptions.
I feel like this might be a point that we disagree on. Let's see what he has to say, but you can't rely on research for everything, right? Let's see what he has to say.
Why I would advise someone who is feeling perfectly well against having that full body scan. He has a yearly CT scan, which is completely nuts because each one gives you a fair whack of radiation.
Yep, CT and radiation, there you go.
One CT view in your lifetime, okay, not such a big deal. But every year, I guess we've just figured out why he checks his genome so often. But okay, let's say full body MRI scan, free of ionizing radiations. And the main reason it's not a good idea to get a screening MRI scan is incidentalomas.
Incidentaloma is another way of saying overdiagnosis. You find something that otherwise would not have caused any issues if you just left it alone. But because you found something, now you need to work it up, you need to diagnose it, you need to biopsy, you need to treat, and those things aren't always good, despite what a lot of people, especially outside of medicine, may think.
If you come to hospital with abdominal pain, I do a scan on you. If I see a blob in your abdomen and you're having abdominal pain, well, I'll feel confident in saying something is wrong. But if you're having no symptoms and I see some blob in your abdomen or a cyst on your kidney, I have no idea if some of them, none of them, all of them are significant. I tell you, I can't be sure. I suggest repeating the scan in 3 months.
Little side note here, this is another reason why a lot of people overplay the effect that AI is gonna have on diagnosis, because while diagnosing something is one issue, actually understanding the clinical significance and what to do with that clinical significance is another issue. And obviously computers and AI aren't gonna be as well suited for that, at least not initially.
Screening scans do not improve mortality, they just increase health anxiety, they increase the costs to the individual, and they over-medicalize normal life. Thinking these risks won't apply to you is something called exceptionalism bias.
See, a lot of rich people actually fall for this trap where they think that going to a concierge medicine doctor and getting over-tested for various things, whole body MRI, whole body CT every year or whatever, is gonna result in better outcomes. But as Rohin is pointing to, not the case.
I love my Apple Watch, but for the vast majority of people who buy it, the ability to detect atrial fibrillation and irregular heart rhythm will be useless. False positives will dwarf true positives, even if the detection accuracy was one of the highest on the market, which it isn't. There are going to be way more false positives than true positives. And if you get an alert from your watch, it's almost certain to be incorrect. Unless you're elderly. Under 65s, the likelihood of a positive AF detection episode on an Apple Watch actually being AF are less than 5%.
So this is a really good point he brings up. This comes down to statistics, right? There's positive predictive value and negative predictive value, meaning that if the test tests as positive, what is the chance that it is a true positive versus a false positive? And the negative predictive value is the same, just with the opposite result. And then sensitivity and specificity are related concepts. And essentially with any test, you can't have it be 100% accurate, where you're gonna get every positive and every negative right. You have to draw the line somewhere, and you can optimize for more sensitivity or for more specificity, where you catch more of the positives or you catch more of the negatives, but as a result, you're going to have either more false positives or more false negatives, depending on where you draw that line.
Type 2 diabetes is abnormally high blood glucose. Recently, continuous glucose monitors have become easily available.
Now I see why people wanted me to watch this video.
Brilliant devices, and can wirelessly link up with your phone all day long and record accurate, near continuous body sugar levels.
Yeah, I'm wearing one right now. I've been wearing one like every day for close to the last year.
They're life-changing for diabetics, an example of tech and medicine coming together beautifully. But the longevity, high-performance guys have got their hands on them and started using them even though they don't have diabetes. Peter Attia, another very smart guy.
I follow and enjoy the content from Peter Attia as well.
He's a doctor, but it would be fair to say has a tendency to promote unevidenced medicine, and of particular interest, which I didn't know before researching this, he was a paid consultant for a company that makes continuous glucose monitors, or CGMs.
All right, so first of all, I like Peter Attia. I identify with him in certain ways. He's a general surgery residency dropout. I'm a plastic surgery residency dropout. He likes cars and going to the racetrack. I like cars going to the racetrack. He follows Formula 1 closely. I follow Formula 1 closely, etc. So one thing to note here is that I feel like we're gonna get into the discussion of evidence-based medicine. Now, evidence-based medicine, what it has kind of become is people saying, hey, if there isn't robust evidence to support it, then it's garbage. It's nonsense. You can't do it. But remember that the absence of evidence is not the evidence of absence. Now, it is very important. He pointed out that Peter Attia is a consultant or whatever it was, some financial conflict of interest with a CGM producer. The thing is, when you see these financial disclosures, that doesn't mean you completely throw out their opinion. You just acknowledge that they could be biased, because some people are gonna be very much biased and then push snake oil if it makes them money, whereas other people are gonna say, hey, you know what? I believe in this, that's why I'm investing in it, and sure, I might be slightly biased now because I have an incentive to do so, but I got into this because I believe in it, and this is why I'm doing it. As an example, I actually bought my CGM with my own money a couple years ago. I found it so useful after using it for a month that I then reached out to the company and said, hey guys, can we work together? I really like what you're doing, and I think it's gonna benefit my audience. So since then, I have done several videos, and you can see some of them right here.
People can watch their blood sugar respond to things they eat. It just kind of goes here on the arm and connects to your phone. But complex carbohydrates can also cause an elevation, like potatoes, brown rice, whole grain bread, and fruit, whereas pure fat and protein to a much lesser extent, which has led a lot of these people to conclude that this is objective evidence that carbs are bad for you and that you should stick to a purely keto or carnivore style diet.
Okay, so this is probably where me and Rohin are gonna disagree a little bit. And again, I love Rohin, nothing against him personally. I don't know that many people, and again, on social media, the small minority gets very vocal. I don't know that many people who are saying that all carbs are bad and therefore you need to have a ketogenic or carnivore diet after wearing a CGM. That's definitely not the conclusion I have come to, or any of the other friends I have who wear one and approach things with a little inquisitive curiosity.
But that's based on the assumption that a physiological variation in your blood glucose, as all of our blood glucoses do vary, that's assuming that a normal variation is actually pathological.
Well, no, not necessarily. So the question then becomes, what is a normal versus a pathological variation? Because the goal isn't to say, hey, I'm never gonna have any spikes or any variation. The goal is to say, how can I be more intentional about what those spikes are, how big they are, my diet, my exercise, my sleep, the things that influence it. So after a workout, sure, I'm more willing to spike and have some quick carbs because I want to be in a state of anabolism, building muscle. And then later at night, when I have greater melatonin levels in my body and that inhibits insulin secretion from the pancreas, now I'm going to avoid maybe that same thing I had after my workout that spikes my blood sugar a little bit higher. So there's a lot of nuance here.
There's no evidence that these gradual, short-lived rises in blood glucose are harmful.
Gradual, short-lived, I agree, they are normal, they're not pathological. But someone who appears healthy, even like myself, I have gone to 200 plus with my blood sugar, which is definitely not good. The issue here is that repeated insults over years and decades, that's what leads to metabolic syndrome, that's what leads to diabetes. So you don't just wake up one day and say, oh my God, now I have diabetes. I mean, type 1 diabetes is a different issue, but for type 2 diabetes, it's generally an issue of repeated insults and lifestyle choices over years and years.
And indeed, you're only getting half the story by concentrating on CGMs. If there was a continuous triglyceride monitor, which is a kind of fat molecule, you'd see that a high-fat meal causes elevations in this after eating. It's almost as if you should have a varied diet.
I think people often go to the idea of having a moderate, balanced, varied, etc., diverse diet. Well, what does that actually mean, right? Does that mean I can still have In-N-Out twice a week? Does that mean I should never have it? Does that mean, there's a lot of nuance here, and I think that maybe it depends on the person. So maybe one person who sees things as a little bit more black and white and says, oh my God, I need to avoid carbs at all costs and I'm gonna go straight keto. Keto is fine for some people, not fine for others. It depends on the person. But I can confidently say that this has been a massive net positive in my life, and I know for many of my friends as well.
A rise in a similar manner to the same kind of level and with the same return to baseline? Exercise. Blood glucose can really shoot up, as can your blood pressure, but is anyone going to suggest that exercise gives people diabetes or hypertension?
No, but I mean, there's the context, right? So yeah, I noticed that my blood sugar rises with intense exercise, not lower intensity exercise, but I'm not afraid of that. I don't think that is harmful to my body. I think that doing exercise is a net positive, and the rise in glucose there is not an issue, right? Because then you have other hormones, adrenaline, cortisol, etc., that are influencing that. So you can't just do a blanket statement and say that all increases in blood sugar are bad.
And patients now say that they've stopped eating fruit because they saw their blood glucose shoot up after eating an apple or an orange. And please don't believe all the claptrap about fruits being bad for you.
I don't think fruits are bad for you, but again, in moderation, right? So if I'm having 3 bananas right before I sleep, I'm gonna spike so hard. Whereas if I'm having 1 banana after a workout or 1 banana during the day, it's probably not an issue.
A high sugar is a high sugar, you say. I don't want my blood glucose going up. Well, you've heard of the concept of anti-fragility. Exercise stresses you, but makes you stronger. The immune system develops by being exposed to pathogens. If you replace glucose with a blood test called a CRP, an inflammation marker, you'll see CRP go up with pathogens. But if you employ the same rationale that a raised level is bad and you should try to avoid any raised CRP, and you meticulously avoid anything that might provoke an immune response, what happens? Well, you end up with the rate of severe allergies shooting upwards, as it has done in recent decades.
And this is the hygiene hypothesis for the immune system, but
it's obviously the immune system and the endocrine system are very different. So this is not a perfect analogy.
I think what he's getting at though is that you want to be spiking your sugar occasionally because it's a way to be more anti-fragile for your system and test it. But I don't agree with that. if you are constantly spiking, eating bad food, eating French fries, cool, you're spiking really hard, man. And oh, don't worry, you're having kale and salad tomorrow. But if every Monday, Wednesday, Friday, you have your French fries and a burger just to make sure you can spike and, anti-fragility, then guess what? You're gonna have really bad health outcomes in the long term. Again, repeated insults like that are not necessarily a good thing. And I think comparing blood sugar spikes to exercise, stress compared to hygiene hypothesis for the immune system, I don't think is necessarily a fair comparison.
My point is that we're gathering more data about this than we have ever done before. And we're drawing conclusions and making assumptions which might well be wrong.
So there's two issues here with regards to the blood sugar. So on one hand, I think Rohin's assuming that everyone that wears a CGM wants to just eliminate spikes at all costs and never have it. No, not necessarily. And not everyone who wears one is going to become ketogenic or go on a carnivore diet, as an example. I actually do want a spike right after a workout, as an example. And then on the other hand, he's making the argument that you actually want some spiking, some variation, because it's good for your body to challenge it. But in Western society, in modern society, our issue isn't that we aren't spiking enough. That's definitely not our issue. And as someone who has been eating very clean and healthy for years, ever since I got my own GI issues, I've been surprised myself as to how hard I would spike, going 200 plus at times, which is not ideal. Our issue as a society definitely doesn't lie with not challenging our endocrine system, our pancreas, enough.
We're not computers. A bit of abnormality is normal. The more intensely we look at ourselves, the more we learn that human biology has an enormous signal to noise ratio. But right now, it is way too early to be using this raw, unvalidated data to make big decisions about your health. But please see these full body scans and longevity or wellness influencer plans for what they are, money-making schemes.
Again, a lot of the wealthy fall for this because they usually think that more is better. So one thing I've had an issue with when people talk about evidence-based medicine recently is that I think the focus is too often on, is there robust evidence for this? And that's not really what evidence-based medicine is about. It's about, sure, look at the best possible evidence that we have available right now, but then also you want to use the clinician's judgment as well as the patient's priorities, those three factors, to make the best informed decision. So let me give you an example. If there was a study that said, if you wake up at 6 a.m., then you're going to be more productive, right? And that's how studies normally work, because you need a large population. So you find these trends over larger populations, but there's probably variation, right? Where some people are more early risers, some people are more night owls, and there's a normal variation. You can argue that, well, more people who think that they're night owls are actually early risers because of bad sleep hygiene and backlit devices like phones, but whatever. What I'm getting at though, is that whether or not that research study said, wake up at 6 a.m. or it doesn't matter whether you wake up at 6 a.m., it doesn't really matter what the outcome of that study is. The point is that I need to find out for myself what is best for me. And part of the reason that I'm comfortable doing that is because the cost-benefit analysis makes sense. It's not very risky for me to wake up at 6 a.m. versus 9 a.m. and then just test the results. So similarly, if I'm wearing a CGM and I'm trying to minimize my spikes throughout the day, except for after workouts, then what's the actual downside of me eating fewer refined carbs, eating less chocolate, not drinking calories, with juices or sodas or things like that? A more pertinent example of this actually happened last year with my gastroenterologist. So I brought up a study that suggests higher vitamin D levels are associated with longer term remission with people who have IBD. And I told him, I want to take vitamin D supplementation. In fact, I have been. And he said, no, that's nonsense. The evidence is weak. This is just correlational. It's simply saying that people who are healthy and who go outside and are active, they tend to be in remission longer. So it's confounding. And I agree with him. I don't know whether it's the chicken or the egg. It's probably healthy people going outside and being active that results in remission. However, what is the risk of me taking a little bit of vitamin D supplementation day to day? There could be a benefit. We're not sure. The evidence is not conclusive, right? But if the risk of me taking a high quality, reasonable dose vitamin D supplement every single day to keep me in that nice, good range for vitamin D levels, if that risk is so low, then why not do it? Just because the evidence isn't super strong doesn't mean I need to avoid it at all costs. So when you take this way of thinking, where you're not just looking at, oh my God, is there research for this thing? And if there isn't, then I shouldn't do it. But you take the pros and cons, you look at it with a little bit more nuance and subtlety, you're just gonna make better healthcare decisions overall. Better decisions anywhere in your life, actually.
Every time I hear about some new app or screening program, I think of my 80 plus, 90 plus year old patients who are still going out dancing, hiking, sailing, golfing, and they're mentally just as sharp as ever. And they didn't do any of this nonsense.
Survivorship bias, hello. Just because they didn't do it doesn't mean that it's not adding any value, right?
Staying fit, staying active, eating healthy food, and enjoying life. So do those things, and let's keep you out of my clinic room.
I agree that there are certain core things, and I talk about the 3 pillars of nutrition, exercise, and sleep, and you can also argue a community when it comes to these populations that live a very long time. While those things are important, I mean, I'm using tools to further optimize my diet, to further optimize my sleep. And I don't think the two are mutually exclusive, which is what is kind of implied right now. All right, guys, that was a fun video. Really well done video by Rohin Francis, my friend at Medlife Crisis. Go show him some love. Let me know what video you want me to react to next. Much love, my friends, and I'll see you guys in that next one.